Dozens of products from Quaker Canada are being pulled off the shelves due to salmonella concerns. This includes multiple flavors of the Quaker granola bars and cereals. The Canadian Food Inspection Agency says its investigation was triggered by a recall in another country. There have been no reported illnesses connected to this as of last check. This recall comes on the heels of another salmonella scare late last year. 5 Canadians and 3 Americans were killed after ingesting tainted cantaloupe. In that case, hundreds of people also became sick. Brian Coombs, a professor in biochemistry, biomedical sciences at McMaster University, joins us now to discuss what's behind these recent outbreaks. Professor, thank you so much for joining us today.
Thanks for having me.
So we haven't had any reported illnesses connected to the Quaker recall as of now, but what kind of impact can eating these contaminated foods have on our bodies?
Foodborne illnesses cause symptoms ranging from vomiting, nausea, diarrhea, dizziness, headaches. They can range from very mild symptoms to very extremely severe symptoms that would require hospitalization or people seeking medical attention. So it really is very specific to the individual, and different individuals can have different responses to things like this.
Is there any way, if you're at home, that you can spot salmonella contamination yourself?
It's very difficult. Obviously, we're talking about small bacteria, which are microscopic. You need a microscope to see them. You can't see them with your eyes. Oftentimes, they don't produce any type of odor or smell that would cause you to, suspect that the food that you're about to ingest is contaminated as well. So really the goal here with this public health notice and this recall is to get people more aware of what those products are. Really, it's, go through your pantry and your shelves and look to see if you have these things and get rid of them if you do.
So obviously our foods are all produced a lot differently. What kind of practices could be leading to this level of contamination?
I would say it's very difficult to say. With foodborne outbreaks, and especially outbreaks with salmonella, these outbreaks are not linked to one particular type of food or food product. I mean, when you look at the recall, if you look at Center for Disease Control in the U.S., the outbreaks that they have investigated over the years linked to specifically to salmonella in food, the food products are all over the place, ranging from produce to meat products to prepackaged products like the ones we're talking about now with the Quaker products. They're all over the place. And so, and the reality is the contamination can get introduced anywhere along the food chain, right from, if we're talking about produce, right from the source on farms, right out into the fields, anywhere along the manufacturing line.
You talked a little bit about, what salmonella is and the bacteria there. Can you talk a little bit about the conditions in which salmonella can help, or the bacteria can be born?
I mean, salmonella it's a very hardy bacteria. It can grow in all kinds of different things, and it can grow in, it can live in water, and it can live on food products. It can withstand acid stress, lots of different things. And so it's very difficult to, eradicate bacteria from our environment. They're everywhere. And so what, the food industry is doing is, minimizing the potential introduction of contamination and risk by having good, safe hygiene practices within their plants and understanding where the food, the raw ingredients are coming from.
Okay, can you talk a little bit about hygiene practices at home that maybe we can also undertake?
Sure. I mean, for foodborne infections like salmonella, I mean, the big one is hand washing. So when you bring food home into your house, before you handle food, wash your hands. If you are working with types of foods that are potentially high for contamination risk, like raw meat, for example. If you're cutting raw meat, then of course you would want to wash all the cutlery and utensils used in doing that before you're using them on other things. And really just paying attention to best before dates and recalls like this.
Those are some great practices to be reminded of constantly. Professor Coombs, thank you so much for taking the time to speak with us today.
My pleasure.
That is Professor Brian Coombs, who is a professor in biochemistry, biomedical sciences at McMaster University.